Hello dear friends, welcome to PharmaGrid. So today we will continue with the Biopharmaceutics and Pharmacokinetics related questions discussion series. Question number 71. pH is equivalent to pK at, the options are pH of 7, pH of 1, pH of 14, half neutralization point, neutralization point. Here the correct answer is option D, that is half neutralization point. At this point acid bar base or acid by base value is 1 and the log of 1 is 0. At that point pH will be equal to pK. Okay, so the pH is equivalent to pK at half neutralization point. The study of the time course of drug absorption, distribution, metabolism and excretion is called. The options are pharmacodynamics, drug concentration, pharmacokinetics, kinetic homogeneity. Here the correct answer is option C, that is pharmacokinetics. That is a study of time course of drug absorption, distribution, metabolism and excretion is called pharmacokinetics. And the option A is wrong because pharmacodynamics deals with the relationship between the drug concentration at the site of action and the resulting effect. And the option B is wrong because drug concentrations in plasma and tissues are what result from pharmacokinetic processes. And option D means kinetic homogeneity. It describes the relationship between plasma drug concentration and concentration at a receptor or site of action. Next question. The EC50 refers to the drug concentration at which the options are 1/2 the maximum response is achieved, the maximal effect is achieved, tolerance is likely to be observed. Here the correct answer is option A, that is EC50 means it is the concentration at which 1/2 the maximum response is achieved. B is an incorrect option because the 50 in the EC50 refers to 50% of the maximal effect. And option C is also wrong because the term EC50 refers to pharmacological effect and not to the tolerance. Next one, it is a true or false question. The therapeutic range is the range of plasma drug concentrations that clearly defines optimal drug therapy and where toxic effects cannot occur. Is the statement true or false? So here the correct answer is option B, that is the statement is a false statement because although the therapeutic range of a drug describes a range of plasma drug concentrations generally considered safe and effective in a patient population, no absolute boundaries divide subtherapeutic, therapeutic and toxic drug concentrations for an individual patient. Both pharmacodynamic and pharmacokinetic factors influence a patient response. Highly perfused organs and blood comprise what is usually known as the peripheral compartment. Is the statement true or false? Here the correct answer is option B, means this statement is a false statement. Why? Because the peripheral compartment is generally made up of less well perfused tissues such as muscle and fat. Next one, the most commonly used model in clinical pharmacokinetic situations is the options are one compartment model, two compartment model, multi-compartment model. Here the correct answer is option A, that is one compartment model. Although a two compartment model is often used, it is not used as commonly as a one compartment model. And multi-compartment models are used occasionally for research purposes but are not normally used in clinical pharmacokinetics. In dosing aminoglycosides, which of the following patient populations commonly require an extended interval? Extended interval in the sense greater than 8 hours. The options are elderly patients, neonatal patients, cystic fibrosis patients. Options A and B, all of the above. Here the correct answer is option D, that is A and B, which means elderly and neonatal patients. The cystic fibrosis patients commonly clear aminoglycosides very quickly and may even require dosing intervals of every 6 hours. Next one, drugs subject to a significant first pass effect or significant first pass metabolism following oral administration include. The options are propranolol, nifedipine, nitroglycerin. Here the correct answer is option A, that is 1, 2 and 3. That is all these drugs undergo significant first pass metabolism. That is propranolol, nifedipine and nitroglycerin are all subject to extensive metabolism by the liver prior to the drug reaching the systemic circulation. Which one of the following statements about dose and response is correct? The options are loop diuretics have a dose response curve that reaches a maximum after a few increments of dose. Thiazide diuretics have a steep and prolonged dose response curve. If one drug has greater therapeutic efficacy than another, then it is more potent. If one drug is more potent than another drug, then It can achieve a therapeutic effect of greater magnitude. The therapeutic index is the maximum tolerated dose divided by the minimum effective dose. So in the question, they have asked us to find out the correct statement. So here the correct statement or the correct answer is option E. That is, the therapeutic index is the maximum tolerated dose divided by the minimum effective dose. Remaining all of the statements are wrong. Question number 80. Two drugs may act on the same tissue or organ through independent receptors, resulting in effects in opposite directions. What is this known as? The options are physiologic antagonism, chemical antagonism, competitive antagonism, irreversible antagonism, dispositional antagonism. Here, the correct answer is option A, that is physiological antagonism. This physiological antagonism is also known as functional antagonism. Here, two drugs act on different receptors or by different mechanisms but have opposite effects on the same physiological function. So in a summary, we can say that these two drugs have pharmacological effects in the opposite direction. So a good example is the case of glucagon and insulin. Both act on the pancreas. Okay. And this glucagon will help to increase the blood sugar level, whereas this insulin will help to reduce the blood sugar level. Okay, so this is a good or suitable example for this physiological antagonism. So with this question, we have completed today's discussion series. Thank you everyone. Thank you for your support. Have a nice day.